Procedures for hair growth, or what remedies can be done to promote hair growth. Remember one thing, hair is like a plant. Whatever you see, the growing part is in the root, which is under the skin, That is where your stem cells are there, which regenerate the hair. There are two levels of stem cell. One is lower down at the bulb and one is around the mid level of the hair follicle. Once this root is destroyed, there are no stem cells in that area, then you have to put in a new hair, which is the procedure of hair transplant. So coming back to that later, first things, modify your diet. Healthy balanced diet is important. Certain foods promote hair growth. Have them. Consult your doctor to understand if there's any nutrition deficiencies, correct it. A well-balanced lifestyle is important. Late sleeping hours, stress, all these lead to hair loss. Chronic diseases, chronic illness, all these lead to hair loss. Okay, so make sure that you don't suffer from all these and reverse them. Second, medications. Two medications are FDA approved for hair fall. That is minoxidil, that is in 5%, and other one is finasteride, which is either taken orally or topically. Now, people are worried about the side effects of minoxidil or finasteride, and a lot of that has been written on the net. Most of these things are over exaggerated. The side effects seen in these two are practically negligible, and that is why they are there since more than 20 years, and both these treatments are FDA approved. There is enough science, there's enough literature, enough data, enough of evidence-based medicine on these two to show that they are very safe and they are promoting hair growth. Minoxidil can be taken in a topical form or in an oral form. Now, minoxidil gets converted to an active form called minoxidil sulfate, which depends upon an enzyme called sulfonyl transferase. So now we have a replacement to even put this enzyme in before applying minoxidil in order to boost it. Minoxidil can be combined with other things like procapil, caffeine, capixyl, which are your peptide groups, or it can be combined with adenylyl, tretinoin, melatonin. Each of them promote hair growth in different ways. There are certain formulations even available where there are no minoxidil in it at all, and they just have adenylyl, procapil, capixyl, caffeine, herbasol, and so many other substances. Each one of them help in hair fall. Some of them increase the anagen phase or the growth phase of the hair, so they make the hair stronger. Some of them increase the blood supply to the scalp, so there's better nourishment and nutrition to the roots. Some of them reduce the inflammation. Inflammation causes more hair fall. Okay. Some of them help the oxidative pathway. Some of them help the stem cell pathway. So each one of them work at different levels and help in different ways. Now, besides this, of course, a very popular therapy for hair fall and to improve the quality of the hair is PRP. PRP is known as platelet-rich plasma. We take your own blood, we isolate the platelets from it, we concentrate these platelets, we activate it, and then we re-inject them back into your scalp. The platelets go there and they secrete growth factors which stimulate the cellular mechanism and stem cells of the hair follicles. This is exactly how they act. This therapy typically has to be done 3 to 4 times at a gap of 1 month each, and then twice or thrice a year as a maintenance therapy. Now, another form of PRP is GFC, where you don't rely on platelets to secrete the growth factors, but you directly isolate the growth factors from the platelets and you inject them into the scalp. The growth factors do the same role what the platelets will do. Whether PRP is better or GFC is better, there's a lot of debate amongst doctors too. But generally speaking, if you get good level of platelets, then PRP is a better therapy than GFC. A therapy which is even higher than this is known as SVF or stromal vascular fraction. You actually take stem cells from the fat, your own body fat, you remove the stem cells, you remove fat, you lyse it in a special machine, you remove the stem cells and inject it into the scalp. The advantage is that you get stem cells in millions, which is not possible with PRP. Number one. Number two, this therapy only has to be done once a year. So, of course, it is a little more invasive than PRP and GFC, but the advantage is that you get far more number of regenerative and stem cells than you get in PRP and GFC. And of course, it has to be done only once a year. So that is a big advantage of SVM. Then, of course, you can take ectodermal stem cells from a punch on the back of the head, which can be done and taken. Now, there are many machines like DermaVidya, etc. available. they also give good amount of stem cells, but the amount of stem cells given by them is less than SVF. The advantage of these techniques are that they're easier to take than fat and easier to process these stem cells. Now we have something known as exosomes in the last 2-3 years. Exosomes, what stem cells do is they release exosomes, and these are the mechanisms or the vesicles which actually stimulate the cellular mechanism. They contain DNA and RNA. So we are directly isolating exosomes, whether it is from humans or from plant cells, and giving it into the scalp, injecting. So it works very well. The effects can be multiple, better than PRP or higher than PRP, because the number of regenerative cells are much higher. Of course, it's only around 2 to 4 years old. So we need to see. We have been using more and more exosomes in our practice and seeing great results. But like PRP and GFC, it has to be repeated at least 3 to 4 times in a year, because the effect will go away with some time. Now, ultimately, then you have mesotherapy. So mesotherapy is artificial growth factors or artificial stem cells or lab-grown stem cells or nourishment, proteins or anti-androgens like glucostride, which are directly taken, or vitamins. So we can either nourish the scalp, we can directly inject it into the local levels, or we can do anti-androgens, or we can even inject minoxidil. So mesotherapy works in many, many ways. Microneedling can also stimulate the release of growth factors, which can be used. But the level of growth factors is lowest in microneedling as compared to other techniques. Ultimately, when the hair follicle is destroyed and there is no hair follicle to regenerate, like a plant, if the root is completely destroyed, you have to put a new plant with new root, exactly like hair transplant. You take hair from the back and the sides, or from the body like beard or body where it's relevant, and transplant it into the bald areas, because these are the strong hair which are genetically programmed not to fall. They will fall either at a very late age or they will not fall throughout life, and hence we take from here. Either we can do the FUT or the FUE method. Both have their own advantages and disadvantages, but finally you have to do a hair transplant when there's a completely bald scalp. There's no hair root to regenerate at all.
For more such videos, visit or log into DermaVidya.com.